The topic of this short presentation is appropriate use of decision support tools. Decision support tools, also known as protocols, algorithms, and guidelines, are valuable tools in the performance of telephone triage, but they can also get in the way of safe and effective care delivery. Decision support tools provide clinical rules for handling calls and giving advice, and they guide the nurse in decision-making but should never supersede nursing judgment. They should provide structure without being inflexible. Note that we're calling them decision support tools, not decision-making tools, because it's been found that when nurses can't use their training and make judgments that consider the patient's nursing and medical needs and their barriers and preferences, that less optimal outcomes may result. The value of decision support tools is that, first of all, they do represent the standard of care. They're valuable sources of information which can be used to guide and standardize decision-making within the organization. They can serve as a checklist to ensure that important elements of care haven't been overlooked. They complement and stimulate a nurse's existing knowledge base and serve as a source of information where the nurse has a knowledge deficit, and then they do support the nurse's rationale and reasoning in decision-making. However, over-reliance on decision support tools can do more harm than good. The consequences of over-reliance include the following. First of all, the documentation format that's embedded within the decision support tool often directs and thus can potentially misdirect the course of the interview. Perhaps in an effort to save time, many nurses have been taught to select the protocol early in the interview as soon as a patient articulates a chief complaint, but in fact, this approach often encourages the nurse to prematurely select the wrong protocol, which can mislead the nurse and actually, in the long run, lengthen the encounter. Strict adherence to decision support tools, especially if the nurse is encouraged to read the script, can also interfere with that extremely important nurse-patient connection. Next, when a nurse, in his or her professional judgment, wishes to change the recommendation of the decision support tool, this may result in selection of a higher or lower acuity disposition. The latter is considered downgrading the disposition and should generally not be done unless there is a compelling reason to do so in the judgment of the nurse. However, in some settings, nurses have been prohibited from downgrading under any circumstances, and in those situations, such prohibition can stifle critical thinking and result in patient mismanagement. Research has also indicated that nurses who have access to protocols are less likely to use the nursing process than those who don't have access to protocols. Now, please don't get me wrong. I am not saying that decision support tools are a bad thing. I'm simply suggesting that if they're used wrong, they can do more harm than good. I think one of the primary values of decision support tools is as a checklist. An analogy might be the pre-op checklist. All nurses know how to get a patient ready to go to the OR, but we all know from experience that if we don't follow that checklist, we're likely to overlook something important. I think a parallel analogy that is near and dear to my heart as much as I travel is the pre-flight checklist. And I think there are a couple of parallels here to telephone triage. The first is, I always hope that the pilot knows a lot more about what's going on the airplane than those few things on the pre-flight checklist. But I also hope to goodness that the pilot doesn't even think about taking off until he or she has actually checked everything on that list, because just because the flaps worked coming in here doesn't necessarily mean that they're going to work going out. I would say that the same applies to us on the phone. We better know a lot more about what's going on with our patient than the few things on that short checklist, but please don't ever hang up the phone until you've actually reviewed the decision support tool to be sure that you haven't overlooked anything important. One of the misconceptions about telephone triage is that they say if you follow the protocol, it'll prevent you from making a mistake and protect you if you're sued. But in fact, the best way to protect yourself and your patient is to use critical thinking. One of my favorite quotes is that consistency of decisions has been used as a proxy for appropriateness of advice, and we all know that the hallmark of professional nursing practice is individualization of care. In fact, there are aspects of the professional expertise and reasoning of nurses that resist being transformed into rules that can be embodied in so-called expert systems. In looking at decision-making by telephone triage nurses, it's noted that determination of urgency is usually based more on critical thinking and pattern recognition than the asking of the recommended questions. So, proper use of decision support tools is as follows. Number one, complete your assessment before you select the protocol to be sure that you have selected the proper protocol. Number two, review all appropriate protocols and then take the highest level of action recommended. Remember that protocols do not represent artificial intelligence. It's important that you deviate and document why you deviated when it's indicated. And then be certain to use the nursing process and think about what you're doing. Above all, although decision support tools or protocols are a wonderful and necessary tool in the provision of care by telephone, it is critical that the professional nurse avoid over-reliance on those protocols.
Carol Rutenberg is a nationally recognized expert and speaker in the field of telephone triage. To learn more from Carol about the ideas in this video, you can refer to The Art and Science of Telephone Triage, written by Carol and her colleague Liz Greenberg, and endorsed by the American Academy of Ambulatory Care Nursing. This video training series was produced and sponsored by ClearTriage, an online version of the Schmidt-Thompson telephone triage protocols that is compatible with Carol's teachings and widely used as a decision support tool for telephone triage nurses in practices and clinics.